I think we're recording now.
Does whoever has the first slide want to start us off with an introduction?
Yeah. So should I start? Okay. Hello, we will be discussing about the system of radical belonging and its importance on the healthcare providers and the effects on the works. It is important to belong to a healthcare team in order to encourage and help each other. When one works in isolation, the person is likely to be stressed and lack someone to extend a helping hand when the body refuses to respond to the increased pressure at work. Also, it is beneficial to educate healthcare workers on the importance of the teamwork. And to define radical belonging, we should know first, and according to the McGill in the article Voices of Diversity, that belonging is a sense of fitting in a team or group. Also, it is feeling of security and support when an individual feels a sense of identity and acceptance. So in the view of this, radical belonging is the far-reaching or thorough sense of fitting where an individual feels accepted in a team or group. It also implies that a person is committed to a given group and will adhere to the rules and regulation guiding the place. Healthcare workers need to know that radical belonging promotes strong working relationships and allows people to learn from each other. Also, can embraces teamwork, which allows members to build on ideas and different perspective of seeing things. Next, please.
Can we go back a slide? Thank you. So as we discussed, radical belonging requires a collective team approach in which every team member is committed to respecting, accepting, and valuing their other team members for who they are and for their contributions to the team. And this approach can lead to transformational inclusion, whereby each team member is provided with the support they need. In their book on radical belonging, Lindo Bacon talks more about this. They have a background in the effect of trauma on the body, and they identify as genderqueer. So they specifically looked into this concept of radical belonging and found that it had very positive outcomes when it was made a priority within healthcare. It had outcomes of improved overall health and well-being for individuals, especially those who experience marginalization. And so this has good implications for those working in healthcare, especially on a diverse team. And so when each team member assumes responsibility for promoting radical belonging on the team, every team member and the team as a whole can thrive, which is beneficial at the organizational level for hospitals, for each member of the healthcare team, and for the patients that they serve. Radical belonging encompasses ideas presented in the more recent literature regarding building strong teams through a sense of community. And the effects of radical belonging and best practices for promoting it within healthcare are currently still being studied.
So as far as our proposal for the Hope Commission, our overarching goals are to enhance radical belonging, improve workplace conditions, and to decrease the employee turnover or burnout at M Health Fairview. And we hope to do this on the following levels: organizational, team, and individual. So to begin with the organizational level, we hope to provide a means of support, gratitude, and encouragement for the healthcare team. This would consist of possibly more PTO or sick days and hosting monthly company-wide treat days or incentive days and employee giveaways. And also to clearly present and enforce requirements like mask wearing and vaccination requirements amongst hospital employees to try and reduce those polarizing differences that exist with more lax requirements on those topics. Then looking on the team level, we plan to implement designated time for team huddles and monthly team meetings, and also to establish a system to report and also address any team concerns that might be affecting anyone on the healthcare team. And then on the individual level, we will encourage employees to use allotted PTO each year, possibly by introducing a no rollover policy to ensure that employees actually are using it to help prevent that burnout. Also to kind of along the same lines, provide paid break times for workers during their shifts, and to host stress reducing outings, for example, fun team activities like sporting events or team bonding out in the community, and to create and distribute informational pamphlets about adequate sleep and nutrition and how those can help reduce stress among healthcare workers, and to provide resources or contact information for support hotlines, local therapists, and other things along those lines. And then as far as addressing the impact on marginalized communities, our proposal will acknowledge disproportionate impact of COVID-19 on those marginalized populations, and specifically those members of those populations who are employees at M Health Fairview, and to foster a system in which employees feel comfortable reporting instances of discrimination, harassment, microaggression, etc., within the workplace, and to take it one step further to actually make sure that M Health Fairview is taking action in these situations. For example, ensuring that repercussions for employees engaging in unjust behaviors in the workplace are taking place, and providing support to the victims of those actions after reports have been made. Then as far as implementation of this proposal, we've kind of broken it down into 5 steps. So step 1 would be arrange. So create a plan that outlines the practice M Health Fairview wants to implement and the reasons behind that. Step 2, ask. Propose the plan to the company as a whole, possibly by creating a brief video presentation, sending out that via email to the company and its employees, and asking for thoughts, recommendations, feedback. Step 3, adjust, would be to consider that feedback gained from the employees and making necessary changes. Step 4, act, would be to actually implement the program on all 3 of those organizational, team, and individual levels. And step 5, adapt. So this is more of the long-term implementation step, which would be to continually ask employees for feedback once the program is in motion and adapt to meet the company's needs.
So introducing these changes come at some financial cost to any company, while introducing more PTOs and more sick days would be very beneficial for the employees, both health-wise and mental health-wise. It comes at a great significant cost, and it would have a burden on the profitability of any company. A grid-based system where employees in the same tier are rewarded PTO or sick days based on their productivity would be very beneficial, and that would negate any financial burden on the company. Different regulations and changes with time of vaccination should have a consideration of the supply and demand of the current job market, especially nursing shortages that were introduced in COVID-19, and that should be always kept in mind. And another motivation factor is always money. So offering per diem or low-com jobs to in-house employees could be very motivational to give them a sense of belonging to that environment.
All right, and then considering ways we can measure our success, one kind of initial thought would be to sort of evaluate based on understanding of the quality of the patient outcomes that are elicited based on teamwork. So an indirect measure would be looking at things like rate of rehospitalizations or complications, and then patient compliance with understanding what they have to do to take care of themselves, directly related to COVID, or some sort of issue that sort of stems from initial COVID infection. And then alternative option would be asking how patients are satisfied as far as what they think about how teams are sort of working together, and creating a better sort of care environment for them. And then another important thing is to continually gauge whether each member has developed a strong sense of belonging and is contributing full value, and without having to deal with certain repressive thoughts or direct commentary from other people on the team. So that could basically be boiled down to encouraging patients to share their thoughts electronically, either through some sort of forum or survey, and then sort of tying that to what is being experienced from an employee standpoint as well. And then it sort of ends up being a continuation of the implementation plan, providing opportunities to share thoughts or report incidents and kind of determine whether or not people think things are being handled fairly.
So we've designed our proposal to be scalable throughout our organization as well as among partner organizations. And we hope we've backed our bold aspirations of change with concrete and detailed methodology of implementation, which outline clear steps to implement our plan with the outlined metrics of success to measure the effectiveness of our proposal, as well as a plan for consistent engagement with the workforce so we can maintain that enthusiasm and commitment to the proposal instead of just having that early adoption and then a quick drop off. And then our proposal also addresses aspects of sustainability, not just in our specific healthcare fields, but within many healthcare fields and professions. Belonging and this sense of being part of something larger as part of a healthcare community can alleviate that sense of burnout, which has been extremely devastating to healthcare professionals during COVID-19. It also improves employee retention rates and creates devotion to a common work ethic and goal. And then we also hope to maintain a sustainability in our proposal by promoting interdisciplinary engagement and employee feedback, which can create a sense among our workforce of being included and having their opinions and input valued, which should increase employee satisfaction and commitment to our shared goal.
Someone did that, so it's the end of it. Matthew, I think you can just stop recording.